Welcome back. The time is 9:41. Time for our Plastic Surgery Today segment with our Bay Area sponsor, plastic surgeon Dr. Stanley Jacobs. We're talking about the skin.
Yes, the largest organ of the body. Did you know that?
I had heard
People
that before. It depends how
liver.
tall you are, though, right?
Depends how big your liver is.
Is the liver second? All right.
Yeah.
So we're talking about, first of all, I guess the way your skin changes with the wrinkles and things like that, right?
Well, I wanted to put a picture up.
Yes, go
I
ahead.
don't know if you can see that well. Maybe
We'll zoom
a little
into
high.
it. Okay.
Okay, you'll zoom in. Okay. But basically, the skin is more complex than you think.
Okay.
And under a microscope, you get to see lots of stuff you don't normally realize. Like this upper layer that looks like a piece of foam is your epidermis. That's the outer skin.
Okay.
And then the deeper part's your dermis, which has all these nerves and blood vessels.
Oh, here, let me take it so people can really check it out. Okay, so you get the different, they're zooming in over here.
All right.
The different layers, you get the outside. Now, so is the outside the first to go?
Yes,
Like, okay.
and that's what gets sun damage. This is the one that gets skin cancers mainly, that start, things that start on the surface.
Is that why I can go to the plastic surgeon and just peel that off me? Give me some fresh.
The upper part. So let's talk about 3 things that can happen to skin that we talk about.
You want to do the age spots? Look.
Let's do the age spots.
All right, go ahead. Take me on camera one. You
so
can see the age spots.
These
are age spots. No, and I saw them. It's not like
right
they
there.
happened overnight. Here, you guys. Here we go. Yeah, see, they're there. It's not like they showed up overnight, but it's like
they get bigger. They coalesce.
Freckles that they coalesce.
Isn't that a good word?
See that? Yeah.
They get bigger. And so what happens is those, you get rid of those. So most of those are superficial. You can use a Woods lamp, which is a light that will show if it shines up, it means it's more superficial, close to the surface.
Okay.
But most of them are.
Okay.
And if you
Okay.
Now this is not a fabulous picture because it's a little detail, but the point is here's the dead skin on top. It's showing the dead skin falling off, which makes it rough. But deeper down are these melanocytes, which have the pigment. And those melanocytes come to the surface.
That's
and
right.
then that's when you get the pigment at the skin level. So
is it not the sun's fault then?
Yes, it triggers the melanocytes to be active.
Okay.
But it's the sun's way of protecting you, right? Because the body's way of protecting you from the sun.
I don't want that kind of protection.
I
really
That's
am not
why
interested.
you have me.
Yeah. Take it off.
So chemical peels can remove that.
Okay.
Okay.
All right.
And there are spot treatments like bleaching agents. Hydroquinone is an agent that you can get. But chemical peels work very well.
Wait a minute. But what if it's cancer?
Okay.
How am I going to know? Can you see what I'm saying? That could be like a bad thing.
Well, most cancers have some warning signs, and these are the warning signs. So if you want to hold those up.
All right.
So we call them the A, B, C, Ds they have in this case. There's actually another one. But normal stuff is smooth and round. Bad stuff is all irregular edges.
Right.
The borders are smooth, good, irregular for bad. And if they change colors like blue, green, or red, that's not good. Or they don't have it here bleeding. Or if they suddenly increase in size. Yours will, just brown spots that coalesce, they meet. That's benign. That's not bad.
You can tell.
But if something doesn't heal, it's bleeding, it's scabbing, it's changing color, that could be melanoma.
Okay.
That's the really bad one.
All right.
The basal cell cancers are the ones that are a dime a dozen that still need to be removed.
Do we go to a plastic surgeon?
You go to both, plastic surgeon, dermatologist, somebody who's going to assess your skin well and treat it properly.
Right.
And there's a lot of people working on this, but skin peels are very healthy.
Skin peels are healthy and they make you look good. I like that.
I love that.
Okay.
All right.
All right, great. If you want any more information about what Dr. Jacobs has talked about today, you can visit his website. You can also call him. There's the number on your screen, 433-0303, or go to drstanleyjacobs.com. Thank you, doctor.